I'm 61 years young, and we've been living in Medina now for a little over 20 years. Been blessed with triplets, 2 girls and a boy, who are 14 years old, and a wonderful wife, Therese, who has been my shining star, my angel for many, many years.
I got married 25 years ago to Bob Rollins. He's a wonderful guy. He's always funny, always athletic, hard worker, great father, just very, very active all the time.
My name is Bob Rollins, and I have pulmonary fibrosis.
Pulmonary fibrosis is kind of the lay terminology for interstitial lung disease, and overall it just means scarring in the lungs. There are approximately 200 types of interstitial lung disease. When we don't know what causes it, we call that idiopathic.
I didn't really have a lot of the risk factors. I really wasn't a smoker. There wasn't really anything that was really something that I did or came in contact with that would really relate to, higher risk.
The disease can be insidious, is generally progressive, but at the same time, patients can have an acute exacerbation where they have a sudden and dramatic loss, over a period of days in lung function. So my patient Bob presented with a sudden and severe hypoxemia or low oxygen levels.
I was first diagnosed with something they were calling bilateral vestibular neuritis. And that was something that really affects the ears. When I was first diagnosed with that, the doctors actually told me, they said, hey, it's gonna be, a pretty uphill climb. I mean, we're gonna have to go back and do some physical therapy and things along those lines. So I was actually in the waiting room for my first session of the physical therapy.
He fell asleep in the waiting room.
She woke me up.
I'm like, Bob, you okay? He's like, I don't know. I said, you were sleeping.
Just at that point, I started shaking. I was shaking really, really bad.
So the nurse comes out and gets him, took his pulse ox, and his pulse ox was 64.
All of us oxygen people know that that's pretty low.
They took him right into the emergency room, and they said he had double pneumonia.
The emergency doctor showed me the x-ray, and it was hard to even make out lungs in the picture. Finally, after several days, they just said, Bob, we really need to airlift you down to the Cleveland Clinic downtown. From then on, I was on a ventilator for about 14 days. They ran several tests. I think they said about 40 or 41 different infectious disease tests, which all came back negative.
I feel that the most important test when evaluating someone with interstitial lung disease is the chest CT scan. This is Bob's CT scan. A CT scan slices you like a loaf of bread, so this is the top part of his lungs. You can see that the middle part of his lungs is normal. You can see this white haziness on the edge of his lungs. That is where he has scarring. You can see there's some holes there. We call that honeycombing. As we're moving lower into his lungs, we can see more evidence of interstitial lung disease. We see some gray haziness. We can call that ground glass opacities, as well as a lot of extra lines that we call reticulation. In the cases where the diagnosis is less clear on the CT scan, then we may recommend further testing. Options could include bronchoscopy or surgical lung biopsy. The next step is to bring these cases to a multidisciplinary discussion where you have your chest radiologist, you have your chest pathologist, and you have your pulmonologist talking through these cases. And with a multidisciplinary discussion, looking at the case from everyone's different perspectives, we can usually confidently come up with a final diagnosis.
probably had about a 25% chance of pulling through.
And when the doctor came in to tell me this, I said, no, Bob's not gonna die. I have triplets at home that are 11. I said, he's not dying. I went to the chapel and I got on my knees and I prayed. And I asked God, I said, please keep my husband here.
Less than 12 hours later, my kidneys had come back. And to this day, I don't have any other issues with those other types of organs. I think that was a big part of how I pulled through the whole situation.
So after 2 weeks, they put him on the pulmonary floor. Dr. Highland, which is his doctor now, was amazing. She took real good care of Bob and has been standing by our side ever since then.
So patients often have low oxygen. Often they need to wear supplemental oxygen.
I'm on oxygen therapy. I have to be on it 24/7, which means I sleep on it and everything else. And that's okay. It's something you get used to.
We frequently ask them to have a portable oximeter so that they can monitor their own oxygen levels. They know when to turn their oxygen up, when they can safely turn it down. And so that's one of the things we often prescribe to our patients. We have several FDA-approved antifibrotic drugs for idiopathic pulmonary fibrosis. There are also immunologic abnormalities in many patients with systemic disorders such as autoimmune conditions, and in those patients there is often a role for immunosuppressive therapies.
I take some medication and maybe some supplements that help with, the immune system and things along those lines as well.
Interstitial lung disease is often a progressive disease despite our best therapies. And in those cases, we consider whether the patient might be a candidate for lung transplantation.
Just recently, Dr. Highland just suggested I get with the lung transplant team, talk to them a little bit about it. The doctor did say, you know what, we're not there yet. And that was music to my ears. You're so good. Don't ever give up hope. Hope is so important. This is Hope by Bobby. Hope is full moon white.
Hope tastes like the greatest sugar-sweetened lollipop. Hope smells like the dry air of the hospital. Hope sounds like the soft beep-beep of an IV. Hope feels like the fluffy fur of your dog who's paralyzed.
Just amazing that he had these thoughts in his mind and could put it on paper. All right, have a great day. Good luck. Play loud. The most important thing that I've learned on this journey is that you really have to continue the lung function. One of the biggest things I think that's helped me in keeping my lung function is pulmonary therapy.
Most patients benefit greatly from participating in pulmonary rehabilitation. It is our nature to slow down and to avoid activity when we have anything wrong with our heart or our lungs. So with pulmonary rehabilitation, we're able to get the patient more conditioned. That translates into improved independence and improved quality of life.
About an hour and 15 minutes away. I do meditate to a point where I get to an area where it's quiet and I concentrate on my breathing. And I do the breathing exercises. And there's a purse breathing, in through the nose and out through the mouth. That works a lot. So many people have helped us. I'm just gonna continue to give back as much as I possibly can as long as I'm alive. What I do is I go in to the patient rooms and I push what they call an activity cart. And a lot of times I'll sit down and talk to people, and they'll see me walk in, I'll have my portable compressor or hose in the nose or whatever, and they'll say, hey, can we just talk oxygen? And I'm like, absolutely. I said, it's one of my favorite subjects. I write about two blogs a month, and it talks about my journey. Some of the things I'm feeling, and I try to coordinate it between like every day and also someone being on the journey and the many challenges and things that we run into as well.
We are finally moving the needle forward, that there's a lot of hope that for interstitial lung disease, no matter what the cause is. And I look forward to exploring those new therapies with my patients down the road.
Everything that I used to do, obviously I can't do it the same way, but it was important not only to me, but to my kids and to my wife and to my family, to try to keep the normalcy in our life as much as we possibly can. And that in itself is just awesome therapy for me.
I don't know where the rest of our life's gonna go, but we take one day at a time right now.
I always thank God every day for the strength He gives me to get through to the next day. And I go out and have my coffee and I stand on the grass and I go, you know what? Thank you. I'm on the right side of the grass today. Poppy!